textbooks, dermatology, primary care. Throughout our lives, we will all interact with the healthcare system. So, what happens when that system is not designed with certain groups of people in mind? As a Black person in America, I have experienced firsthand racial disparities in healthcare. The turning point for me came during the pandemic when at a local clinic, I was asked if I had a red rash on my skin. At that point, it dawned on me that some healthcare professionals did not realize that skin rashes do not exhibit the same way on different skin pigmentations. If something so obvious could be so casually overlooked by a healthcare professional, what other elements of care, treatment, research, and education are also being ignored, and what does it mean for people of color using this healthcare system? I am Vivian Kobusingye Birchall, and in this series, we will take a closer look at disparities in healthcare, speaking with medical professionals and hearing personal stories to get a better understanding of those disparities and explore ideas and strategies for how to bridge the gaps. And right with me is Dr. Stephen Avery from UPENN. Dr. Stephen, welcome to the show.
Thank you. Thank you for inviting me.
So, what is your relationship with the Global Health Policy Summit?
Well, my relationship mainly is focused on capacity building. I am really interested in training medical physicists because there is a big need. There has been a big need, and I think that with the global health catalyst, we're looking at a different way of training the medical physicists of the future.
What does that mean?
Well, it means that we say a different way because we've been talking about we need increase in numbers. We need increase in numbers. Okay, so we see that the numbers haven't been increasing at the rate that they need to be to keep up with demand. And so obviously we need to change the paradigm of how we're doing it. And also the physicist of tomorrow is going to be a different type of person than the physicist of today. Because we have all this technology, we have artificial intelligence, we have virtual reality, we have all these auto tools that are coming out. And so the physicist of tomorrow has to be trained differently.
Right.
So that's where we're looking at, we can't do business as usual. We have to do things differently. We have to change what we're doing.
And how do you select what methods you're changing in terms of the training, and what influences you to pick a certain type of training versus another?
Well, you look at the trends, and when I mention artificial intelligence, that's a trend now where we can see the field moving in that direction. And so we know that, again, 5-10 years from now, that's going to be commonplace. And so if we see these trends changing, then we have to adapt the way we train physicists. And just not just physicists, but train people in the field in general.
Right, maybe one question I should have asked earlier is what exactly do you do at UPENN, just to give us an idea of what kind of training you do.
Well, I'm a medical physicist by training, but I also do administration. I used to run the graduate program at the University of Pennsylvania for about 8 years. I recently developed a PhD program working with biomedical engineering. And then I stepped back because I wanted to devote more time to global health. I also work in the clinic, primarily in our Proton Center. And I teach. So I'll do a little bit of...
You're busy, sir. And this skill ties right into part of what the global health is doing. And I'll just segue into the commission, the Oncology Commission that was recently launched in Sub-Saharan Africa. What is your role in that, and what do you see as the most immediate priorities?
Well, as I mentioned earlier, I think it's the workforce, and that's, again, there are many calls to action. I think all of them are important. Not only the workforce, but developing new technology. Because I see it as an opportunity for us to partner with industry, with national laboratories, with universities, with just private companies. Because there are, again, I mentioned like the physics of the future, because there are tools that are needed. And there are a lot of things that are being developed, like at national labs and industry, that people may not have thought connect to what we're doing, but it does. And those are the things that, I'm really interested in incorporating that into an education program. Because they say we have a graduate program and we want us to do the work on a project, maybe that project could be developing a new device, that can be used as part of the patient care.
Speaking of education, we just heard from Calvin Johnson. That's a different kind of education. It's mostly public awareness. What are your thoughts and, on education in general that is not the contemporary in-school, building and innovating stuff, but raising awareness?
Yeah, so with Calvin Johnson, I think what you mentioned is more like outreach.
Yes.
And educating the public. Very, very important. Even what we do, understanding cancer, we have to educate the public. Not only like the public in general, but cancer is not just about doctors and patients. It involves all of us. We need to educate our community leaders, our religious leaders. We need to educate our children. We need to educate our teachers. We need to educate everyone because cancer affects everyone. And we all need to understand at our level what this means and how can I contribute to this? Because we all can contribute. Again, it's not just about all the scientists and doctors. It's about everyone. Everyone has a role to play in this.
So what do you see as the most immediate steps to take after today, after this weekend's Global Health Conference?
Well, I think it's to build on the outcomes that we've had from the past. I think for each catalyst, we come back and we continue to work, and we demonstrate that throughout this year's summit. And you can see that things get closer and closer, we get to the next step. And so I think that what we want to do is continue. We can't just say, okay, things are fine the way they are. For me, again, I'm focused on more education. And so we're looking at working with IEA, working with FAMPO, and coming up with a model that is a sustainable model for really building up the capacity. We're also looking at another group, which is the After School Physics, which I think that people may not have heard of, but they've been around for, I may get it wrong, but at least since 2015, 2013. And so every 2 years, it's a conference that it's held in an African country. It's focused on math and physics students in Africa. And it's run by national labs and industry, and they all contribute. And so there's 16 different disciplines. We're talking about instrumentation, maybe nuclear medicine, biophysics, medical physics. So all these things can contribute to issues and things that are important to us. But when we talk about building capacity, we need a pipeline. Where do we get the students from? Something like that is where we can, again, educate students about what is it that we do and how can you get into this field. And they're at a young age. After School of Physics starts from high school all the way through graduate. And so you can educate people when they're at a young age, get them involved, maybe give them like an idea of what this field is like. And then, you can have summer programs. As they're in college, you can support them through. And so we want to create that pipeline from very young until you're a postgraduate or professional, and to keep it going. And I think that's a model that we need to create to build a long-term sustainable program.
Yeah, and just from your experience with the summit over the years, what have you identified as one of the biggest challenges? I know that we're talking about all the good things that have happened, but it's not all smooth, as we.
I think the biggest challenge is that, Africa has 55 countries.
True.
And they operate independently. And so you can't just assume that one size fits all. You have to take each country individually with their regulations, with their rules, with everything, and you have to work from there. And then, there may be overlap, you may find connections, but I think that's one of the challenges that we have to really look at and consider, because it's not a one-size-fits-all. And I think that's part of the problem that has been in the past. Is you can come in with a model, you try to implement it in one place and it works, but then you go somewhere else and it doesn't, and then, okay, the momentum stops. So,
right.
Yeah.
And of course, you mentioned Africa, but I also understand, I mean, I know the Global Health Catalyst is also in Europe. And what has been your experience in Europe and maybe Asia and the Middle East?
I mean, I guess, yeah, I agree. I think we're looking at in Europe, where we've done work with in Germany, in Heidelberg. Again, that's maybe around they have a collaboration with Bangladesh, but also they've introduced some technology too, such as solar power radiotherapy, ideas such as a LINAC on a truck, where let's say that, you know, sometimes, like in the States, we have a MR on the truck, so it can drive to a site and come and get your MR scan. Why not have a LINAC on the truck, where a LINAC can go to like a village or rural area, you can get your radiation treatment, and then you can go somewhere else. I mean, these things are not impossible. These things, you know, we can actually do this kind of technology. Again, this is different. It's out of the box. I think this is what we have to do to address the issues that we're talking about. Because obviously, things that we've done are just not going to work, you know, for a long time.
Well, what's the one thing you would like to tell our viewers about this whole process, not just the summit, but the Global Health Catalyst program, that actually has many universities, high universities participating? Yeah. Maybe briefly, could you mention some of the collaborating entities or organizations? Well,
I guess if I was going to say one thing to the audience that I like about the GHC, and I think this is a meeting like no other, because you have the policymakers, you have the students, you have the religious leaders, you have the community leaders, you have the people from sports and entertainment. We all come together as one.
You have media.
You have media, sorry. Media is very important.
Bringing you the information.
Yeah. And we all come together as one, and we leave our egos at the door. It's not like I'm director or Professor X or whatever. You know, I'm here to work on the problem together with you. Doesn't matter who you are, where you're from. We're all here to solve a common goal, and that's what I love about this meeting. Is that you don't feel intimidated about or you don't feel like I'm less than or not good enough. Everyone here has a role to play. And we bring everyone in, and everyone can find a place to help solve this problem. It's a big problem. It's not a little problem. So we need everyone from every walk of life. So that's what I love about the GHC, and I love the spirit of it. And I think everyone that has come here, you probably hear that from them. When they leave, you just feel with so much like excitement and motivation. You just want to go and just take over the world, because you feel like you can.
Yep.
So.
Yeah, absolutely. That's how I feel every time I'm in the midst of everyone at the campus.
Exactly.
Yeah.
Exactly.
It's great. So anyway, thank you again for your time. Thanks for the work you do. Hope this is just one of many conversations we hope to have about what's going on. Just staying in touch with the updates and letting the world know how they can participate. Hopefully. So again, thank you for everything you do, and I look forward to more conversations.
Thank you.
Yep.